Hi, my name is Mary Harbor. I am 39 years old and I'm originally from western Kansas. I've lived in Nebraska since 1994. My husband and I um, have 5 children um, between the two of us. We have Jessica, who's 20, Hannah is 13, Ashton is 10, Brett is 8, and Brock is 6. Um, I was asked by Lindy Miller to help her host the chemo tote drive. Um, she thought that I would enjoy that as well as knowing firsthand also what these chemo patients go through, as well as the things they need when they start their journey with cancer. Um, Cancer has unfortunately touched my family several different times. Um, I watched my mom go through her battle with stage 4 glioblastoma brain cancer. She passed away at the age of 60 in 2004. That was very hard for me. And I knew at that point that, at some point in time, we're all either going to face cancer, whether it be ourselves or somebody that we know. Little did I know, at this point in time in my life, I have an aunt that is also battling triple negative breast cancer, as well as ovarian cancer. She had her bilateral mastectomy the week that I found out that I had cancer also. So our families have been touched quite a bit here recently, even. November 12th, 2014 is when I got my diagnosis. That those 3 little words that nobody wants to hear is you have cancer. I was diagnosed with stage 2B invasive ductal carcinoma, grade 3, which is aggressive. It was poorly differentiated, meaning that it can spread. In December, I had a bilateral mastectomy. They removed both breasts and the tissue, and they removed 15 lymph nodes from my right arm, which 3 of those tested positive for cancer as well. So my journey began to fight this crazy disease that is out there affecting a lot of us. I am very adamant and hope that they can find a cure someday. Until then, I guess all we can do is fight. It is definitely a fight. It is not something that you want to fight alone, because it is a very long, scary journey. In January, I started my chemotherapy. I have a total of 17 treatments to do. The first 6 months of that treatment is the aggressive chemotherapy, which I had finished this May. And now I continue on with my targeted therapy because I was HER2 positive as well as ER positive. The HER2 positive is targeted therapy with Herceptin, which I go get infused through my port every 3 weeks, and that will go till the first of the year. I also did radiation from June 1st to July 16th. It consisted of 32 radiation treatments daily. It was once a day for 32 days. Then I will also be doing hormone therapy, which is oral pill for that for 10 years. in hopes to help keep the recurrence rate down. So I do know, I guess, what the chemo patients go through, because I have experienced it myself. It is so harsh on your body, emotionally and physically especially. You these chemo tote bags, we want to provide to cancer patients to make them feel comfortable with, it's not a comfortable journey, but to know that you're not alone and know any little thing is to help make them comfortable and to help them along their journey. That is what we want to do. When you sit there in the chemo room for 5 hours, 7 hours, 12 hours, whatever the case may be, it is a long time. So if you would like to donate $40 towards the chemo care bag, we will be distributing those bags between the Cancer Center in North Platte as well as Kearney at the Good Samaritan Cancer Center. If you don't want to, if you have a specific person that you would like to donate a bag to, we can do that also. And if you just want to just donate a few items to put in the bags that we'll be putting in there, or even $5, $10, whatever would be appreciated, that would help buy the supplies for in the bag. We are going to do things from blankets to lip balm to unfragrant lotions, magazines, maybe a deck of cards, sunscreen, all those kind of things that I know firsthand that they will need to help their skin heal and to keep their skin as perfect as possible during this journey, because it's very hard. I had everything from my skin peeling off my feet to my lips completely dry and peeling. And then you don't want to be around fragrant things because the smells don't mix well with, your senses are totally messed up with chemotherapy. So that is kind of what I am about and what the chemo tote drive is about. And I'm honored that Lindy asked me to help her. I love helping people, and I'm excited. I want to deliver these bags to these cancer centers and let them know, the patients know even, that hey, you're not alone, and we want you to try to make you as comfortable as possible. I know I will be making a little cards to put in the bags with my favorite Bible verse, as well as just a little bit about myself and my journey, kind of like I'm doing now, just so people can kind of see, hey, this can be done. We can fight and it can be done. So, thank you, and I'm just excited for this drive, and exciting to see us give to other people. Thanks.